All right, here I am with John again. We're going to test his quadriceps strength. Instead of a handheld dynamometer, we're using the Q dynamometer. Excuse me, I think it's a little less clunky, a little easier to use than the handheld dynamometer. I also demonstrate how to use that as well, but I think this is a little more accurate and it's a little bit more hands-free as opposed to trying to touch the button with one hand and get the patient set with the other. Using the app on the phone, there are some advantages, but I find there's some big disadvantages too. So I'm going to have you cross your hands over your chest. All right. And I'm going to have you go for about 5 or 6 seconds. So relax for just a little bit. When I tell you to go, I want you just to extend incrementally. And what I mean by that is just give me more until about 3 or 4 seconds in. You'll be giving me everything you have. We'll go for about 6 or 7 seconds and then we'll stop. All right. So relax here. Good. Ready? And start pushing. Go. Go. Oh, relax again. Relax, 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 relax. Oh, hold on. All right, ready? And go. Push, 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 push. Give it all you got. Give it all you got. Go, 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 go. And time. So he has a peak force of 52.2 pounds and an average force of 44.4 pounds. So we're going to switch to his, this was his affected leg from his stroke. However, we have been working out for a few months now. He has gotten much stronger. We did do this testing in the beginning. All right, just extend here for me. Good. So we're going to look for about a 60-degree angle right there. That looks good right there. All right, and we're going to go back. And same thing as before, you're going to give it incrementally. And when I say go, you're going to start pushing. All right, start pushing. Go, 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 go. Go, 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 go. Give it all you got. 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 And time. And the difference here is dramatic. 99 pounds of peak force and 82.2 pounds of average force. And if we look at that, that compares quite a bit to the other one. All right. The other one was 52 and 44. So almost twice the strength in his non-affected leg than his regular leg. The force dynamometer. The only problem with this is we're using the phone to record on, and we can't really use the app. And that is one of the clunky things about this machine here, is that you have to have the phone and the device, so you have to go back and forth touching the starting. There are some things I like about both, but I can demonstrate how this is done. So it's done pretty much the same way that we use the Q. I'll hit the app, and I'm going to hold this here, and I'm going to tell him to incrementally start. So once I hit start on the it'll calibrate, and then I'll tell him go, and then he'll start pushing. So what we found was when we did this just prior to filming, and we found out that it's pretty similar to the Q. So we're looking at about 45. About 50 peak, 45 average, and we found that on his unaffected leg, he was about double that. Pretty much the same thing we found in the Q. So I think I like the graph that the active force gives you, but I do not like the clunkiness of having to use a phone rather than just hitting a button on a device. So nice thing about this would be, the one thing I do want to say is, when you get really strong people, the one thing you have to worry about. So if John starts extending his leg out, extend your leg out, John, and he's really strong, what's going to happen is he's so strong that he can't keep his butt down. And you're going to find that in really strong people, when they do this, their butt will lift right off. So you could seatbelt them down. you don't want them to uncross their hands, but what will happen is you're not going to get an accurate reading, because if he was so strong, demonstrate, go as hard as you can and watch how his butt will start to lift up off the, he can't do it. See, he doesn't have the strength to do it, but somebody who's very strong, it's hard to keep their butt down, and the angle on the knee will increase, and it's going to give you some false readings, because we want to keep it at that angle here, which is more like 110 degrees. I said 60, that's more like 110 degrees. So you're going to have to be careful with really strong people that they don't lift their butt up and almost have a straight leg. And that's what I noticed in some research that I've done. We had trouble getting that that leg to stay in place. But that's the difference between these two dynamometers. I think they're both equally effective, but I think for this particular test, I would choose the Melic. All right, we're going to do some manual muscle testing for John's hamstring. And the one thing I want you to notice, John's flexibility, I'm going to set this down right here. John's flexibility on his stomach is very much different than on his back. So as we try to bend this up, pull this, go ahead and pull that up as far as you can, John. Pull that to your, there we go. That's all we're getting. So it's very hard to do this test the way that it was demonstrated, because we would want to get that 90-degree angle, but he just can't get there. So if I were to try to test him at 90 degrees, he would have a very low test. So what I had to do with John, and again, you need the phone to be able to use this, one of the drawbacks, I just tested him, and I needed to keep him at an angle out here a little further, then, because that's as far. Go ahead and slowly bring that, your heel to your butt again. That's all he can do. And when I take him and I try to pull, he feels a lot of tightness in his quadriceps. That's all right there. That's all he has. That's a little better in his unaffected leg. Go ahead with your other leg. Pull it back as far as you can get it. That's better. It's better, but not as bad as this one. So even here, push back into me as hard as you can. I'm not getting much. So when I tested John, I tested him about at that angle there. All right, that was more than a 90-degree angle. So that's what we did. So I'm going to explain what I did here. I'm going to bring his leg up to about here, and I'm going to keep it in the neutral position first, and I'm going to put the dynamometer against it and have my hand placed against it like this. There's a strap that I can use that goes around my hand. Not 100% necessary right here. But when I tell him to push, he's going to push as hard as he can, and it's going to be incremental. Then he'll start pushing as hard as he can. So what I'll do is, it's difficult with the phone because I'm supporting his leg here where I want it. So to take my hand and to push the button and then get back in position is a little clunky. But so you push it, get in position, and once he starts pushing, then it'll start. So he'll push. Go ahead and push, 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 push. I'm sorry, pull would be the right word. Go ahead and pull. Pull your foot toward your butt. And pull, 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 pull. There you go, there you go, there you go. Pull, 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 pull. And time. All right. So that's testing his hamstrings in a neutral position. If we want to test his hamstrings, the bicep femoris, as opposed to the semimembranosus, semitendinosus, the hamstrings. So we can rotate his tibia. So if we rotate his tibia inward, which is inward rotation, what I want you to do, John, is just turn your toes inward. All right? And that's all John has right there. And what we'll do is we're testing here, we're testing the inside of his leg. All right, which is the hamstring, semitendinosus, semimembranosus. And go ahead and pull, John. Go, 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 go. And good. Now, if we want to test the biceps femoris, he'll turn his toes outward. All right? And that's going to test the outside of his legs for the bicep femoris. And that's same thing. He'll pull. Go ahead and pull, 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 pull with your toes on the outside. And time. And we had... So he was strongest when his tibia was externally rotated. Neutral was 15 peak, 12 average. Internal was 17 peak, 10 average. External tibial rotation was 18 and 15. So all relatively close in numbers. I wouldn't think there was anything compromised specifically between the different parts of the hamstrings with these numbers. However, I didn't test the leg. I would assume as with the quadriceps that we would see a deficit just like we did with the extension.